Hello, I am Dr. Sangita Chauhan. I am obstetrician and gynecologist at Ekveera Hospital, Aurangabad since 15 years, and my special area of interest is aesthetic gynecology. After your response to my first video, Corona and Pregnancy in Marathi, I am presenting the same topic in English as per suggested by many of you. As you know, Corona is increasing and spreading day by day until we did not get any permanent cure or vaccine for it. So everyone is anxious, and so are the pregnant ladies also. They have many queries in their mind. What will happen if they get infected with this infection? What about baby? What will happen at the time of delivery? They have many questions in their mind. To dispel these queries and anxieties, I'll be more than happy if this video can help. First and foremost question: whether this infection occur in pregnant ladies also? Yes, like general people, this infection may occur in pregnant ladies also. So they have to take utmost precautions to avoid this infection. How will you come to know that you get infected with this viral infection? Actually, there are three presentations. First is asymptomatic presentation. That means their COVID swab test is positive, but they don't show any signs and symptoms. Second is there is mild symptomatic cases. That means they show flu-like symptoms. COVID swab test is positive and they show the picture is of like viral infection. There is a sore throat, rhinitis, light coughing and sneezing is also there. Some patients may show enteritis like diarrhea picture. There is a lack of sense of taste or lack of sense of smell also. And sometimes they may have fever or body ache and generalized weakness. So another category is severe symptomatic cases. There is all these above symptoms are exaggerated, and at the same time they may have shortness of breath or breathlessness, and sometimes these patients need hospitalization, and sometimes they may need ICU admissions also. Question arises in many pregnant ladies' mind whether she can go out for her routine pregnancy checkup. Yes, she has to go for her routine pregnancy checkup. These pregnant ladies need regular evaluation of weight gain, blood pressure monitoring, fetal growth means baby's growth, hemoglobin evaluation, blood sugar evaluation, serial ultrasonography for baby's growth also needed, like NT scan or anomaly scan, and other tests as per her obstetrician asked. So she cannot avoid this pregnancy checkup visit. One thing she can do, she can take prior appointment with her obstetrician an hour before when there is less likely to be crowded. She should follow all precautionary measures, like while going to the hospital, she should wear proper mask, gloves, she should use sanitizer, and she should maintain social distance. Unnecessary touching with the objects or people should be avoided to avoid this infection. Even after all these precautions, till if you get COVID positive, don't panic. As you know, 80% of the patients are asymptomatic. Only few shows mild symptoms. So they need symptomatic treatment as advised by their physician, like paracetamol for fever, warm saline gargles, regular steam inhalation, and multivitamins. Only few cases need hospitalization for treatment under observation, and only few of them may need ICU admission. So first of all, don't panic, because over anxiety, over stress may lead to unnecessary increase in blood pressure levels, and because of this it adversely affects the pregnancy outcome. It means it hampers the fetal growth, and there is a chance of intrauterine fetal growth retardation. There is a possibility of abortion. There is a possibility of preterm vaginal deliveries. To avoid all this, you have to keep calm and don't panic, and be positive, be optimistic, have positive vibes, do regular pranayam, meditation, regular breathing exercise, cultivate good hobbies like gardening, and all these positivities will help in soothing nerves. In present pandemic, with lot of strain on healthcare infrastructure, will I be attended by obstetrician whenever needed? Yes, your obstetrician will attend you 24/7 whenever there is an emergency. Only you need to be in regular contact with your obstetric team. Is there any special treatment protocol or procedure for the delivery of COVID positive pregnant patients? No, COVID positive pregnant patient will deliver either normal or by cesarean section as per her attending obstetrician will decide. Only this paramedical and medical staff would be attired in PPE kits and N95 mask. This may look like an alien, but calm down, don't panic, because behind these face shields and glasses there are the same human carrying medicos. They have to wear these PPE kits and glasses to avoid from getting infection. Corona infection per se does not have any effect on pregnancy outcome. Her obstetrician will decide whether she is going to deliver normal or cesarean section. Post-delivery, will I be able to have my baby with me? Yes, of course. Most of you would be having your baby with you. Only you have to follow some precautions, like while holding or feeding the baby, you have to wear mask and maintain your hand hygiene properly. Only in few severe cases, baby needs to be kept away from the mother to avoid the infection to the baby. In such cases, your pediatrician or neonatologist will take best of care of your baby. And once you overcome the disease, your baby will be with you. Last but not the least, million-dollar question, will my baby get infection from me? Data shows as of now very occasional vertical transmission. That means infection purely from mother to the baby at the time of delivery. So you need not to be worried on this front. In rare case of baby getting infected, data shows treatment would be mild for symptomatic cases and without any harm to the baby's health. Therefore, don't worry, don't panic, have positive thoughts, follow proper antenatal checkup, follow SMS, that means social distancing, wearing mask and use of sanitizer is important. If you follow all these precautions, so then your pregnancy will be healthy. So have healthy pregnancy and my best wishes for your healthy baby. Thank you. Take care.